I like a girl.
Is a girl?
Yes, it's a girl and boy. I'm about.
There are cords, 3 around the neck of the baby.
Era nazuukuka nga mbuleedinga nagenda mu lwaliro ne baŋŋamba ndina omusujja. Era najja nga ndi bubi nnyonnyonnyo bankebera ne balaba nga omwana nga yafudde dda.
Tukidde tukyogereko buzibu ki? Twagala kola sikaani.
Musawo sikaani eyo erina ebizibu byayo nga eyo nayo.
Ebizibu byayo nga wabifunako babikugamba.
Nze byampulira bingi ate nange nina okutya. Sikaani eyo ekozesa masannyalaze.
Mpulira.
Masannyalaze ago bo balaba batya omwana ali munda mu lubuto lwange. Akatiga masannyalaze ago nze bannayo.
Zenze wakati ogakozesa?
Masannyalaze ate tegagenda tukunyingira mu mubiri. Ate bakagenda bendeka ko wali TV obalayita tegagenda kunyingira mu mubiri.
Bingi emigaso gy'omanyiyo gye giriwa?
Yes, ntukumanya oba omwana ali bulungi ne bajjajjaffe babimanyanga.
Ate kati guno omulembe si bwe guli ogw'abajjajja. Tubuulira ebbanga ettuufu omwana mwali, n'atubuulira obuzito bw'omwana bwalimu, n'atubuulira ennebaka y'omwana bwalimu. Kati nkyera wabaayo olulira omwana lwaliira olumanyi. Olowooza dde luyinza kufuna buzibu. Omukyala ayinza dde ofunako obuzibu ki mu budde bw'okuzaala singa aba tebakimanyira mu bwangu.
Kale tulwezingirira omwana mu bulago. Tusobola omutoga.
Okimanyi nti bwe tukola sikaani tumanya nti nno omwana ono alina olulira. Okimanyi mugakawo twazaala omwana ng'alina olulira mu maaso nga lumusibiddeyo n'akagere. Byonna mukazi yali teyakola sikaani babiraba nga balina mulongoosa bulongoosa. Okira nti awo sikaani eba erina omugaso gw'amaanyi.
We have myth and misconception. Removing those things from them has not been easy. They have tied themselves onto such things, and it costs we who know that it's not having a negative effect, because these are just ultrasound. It's not electricity. For them to think it is electricity that goes through them. It's not electricity. It's the sound, but the one you cannot hear with your own ears. So it takes us like a challenge that we are supposed to teach these people that we use sound, we don't use electricity through them to scan all through their babies. And it has no harm. But the ultrasound scans, they really have no harm.
Kino ekintu ky'olaba wano kikuuma amasannyalaze ne gabeera munda nga tegakutuukako direct. So kano akantu ke tuconnectinga ku system zaffe. Abungi oyinza ogisanga halinganga simu zino ennene, ogimu ogisanga laptop mwaconnectinga bwati n'ofuna okisobola okuba interpretation. Kati Betty, ku bye twogedde osazeewo otya tukole ku sikaani tulabe?
Nsawo ngenda kukola.
Neyanziza nnyo neyanzeeke.
When you look at the income of our people, most of them are fishermen. Yeah. So when their catch is poor, there's very little money around. Yesterday, when I met a lady, she thought she is at term. But when she came, I did her scan, and she's 34 weeks. Remember, we delivered 38, 40 weeks, but it's just 34 weeks. So she had to go back. If she was going to a nearby island from there, it would have been a little bit easier and better and convenient for her.
The island needs more machines. It needs more people trained in ultrasound. And with that, I think post-COVID, they were affected in different ways. With those in place, we should see some big impact in terms of delivering ultrasound services, but also in terms of scaling our work.
So we had a conversation with mothers. We talked to mothers and we discovered they had to travel from their home, spend maybe Uganda shilling, which is 5,000, which is about $1.5, to access a scan of about 20,000 Uganda shillings, which is about maybe $6, and then travel back. So there was an extra cost. It wasn't just the cost of the ultrasound, but it was also about the access.
So we saw a very, very big gap in terms of utilization of medical devices. How we come to form MScan, it's when we are all posted up country for our different community placements. We have a very diverse team. Myself, I'm a radiographer. We have Dr. Prosper, who is a medical doctor. We have Ivan, an IT specialist. Philly is also a medical radiographer, but also a research fellow.
And they posted me to a Match Health Center for no electricity, no water. And basically because I could not access electricity, there was no way I was going to practice my craft. Being someone in a white coat in Uganda means you're going to work on patients, whether you are a radiographer or a dentist, they really don't care. So here I am with this white coat and I was thrown into the deep end, and I began to see so many pregnant women die due to conditions that I knew could have been scanned on ultrasound and prevented early. We began to brainstorm and think, how can we bridge this gap? How can we make our craft useful to the majority of the people in our country? And that's how MScan came about. Something portable, something energy efficient, something that we could use in rural areas.
This is much better as comparable to big ultrasound machines that are very power intense. They are very big and they can be maneuvered in places like upcountry settings or small clinics where actually the need for ultrasound is highest.
We went ahead and applied for different grants, seed grants, and we landed on the Up Accelerate program by UNFPA. And these guys believed in us and were like, okay. So they gave us $10,000. We're very excited until it was time to implement. So they connected us to Uganda Industrial Research Institute, URI, where we're allowed to prototype. We began with styrofoam, then we went to wood. At first it looked like a torch, but it was actually something really brilliant. It could detect sound, but we weren't looking for graphs. We're looking for images. Now the gap between the graphs and the images was the hard part. So from version 1 to version 5, we started in 2017. We got version 5 at the end of 2020. Yeah, that's when we managed to get the version that had the good resolution, the perfect gimmicks in terms of we can connect to a Type-C phone, different versions of Android. We've been having challenges in terms of getting that right. And I can say that we've finally gotten that. And version 5 basically had like 10 mini versions by the time we could get one that we could name version 5. So count about 3 years to get from version 1 to version 5. We did our first camp in Bugembe Health Center 4. And I remember walking in and finding a line of 50 women. I'm like, oh my God, this is so cool. Like there's a bunch of people who actually trust us, trust our device. So we did the scans. It was exhausting because by then we were only two. It was just me and Innocent doing that whole line. And I couldn't even speak after, but I felt so good. I felt so gratified because I think we got like 6 complications. And all these women were so happy and so grateful, and the nurses were overjoyed. They were like, oh my God, we wouldn't have captured this if you guys had not come, especially for the ectopic that was an emergency. So minus making the cool device and all, having those first moments where you actually see that you're making a change are very different for me. Yeah.
The Ministry of Health says that Ugandan citizens need to be more vigilant to fight the increasing cases in the country. Masks and social distancing should be maintained in all circumstances.
We were in the middle of COVID and uncharted territory. We did not know what to do, mostly because everything that we used to know as MScan just couldn't work at that point in time. And we had iterated, but then there was no funding. We had thought of something that could take us to the next level in terms of managing in COVID, but we had no funding.
We were stranded as a young company. We didn't know where to go, and of course funding was running short. Our runway was very short, We saw this call, a response, businesses responding to COVID-19. We thought we would actually apply our scans into the home areas. I mean, mothers were home, they couldn't access the basics of antenatal like ultrasound scans, moving to hospitals because of curfew. And with that, we applied and got into a JICA program, the Ninja program, the next innovation with Japan. And with that, it was a blessing for us.
They say challenge is the mother of innovation. So immediately we started to think, okay, how do we get this thing moving even regardless of the pandemic? So that's when home-based care was born. We thought, okay, our device is portable, right? What's stopping us from going to homes? And it enabled us to pilot and find a way to navigate through COVID and still have MScan breathing and living through the COVID season.
With a minimum of 4 antenatal care visits that are recommended by Ministry of Health and the World Health Organization, we can imagine what COVID had on this. The ANC visits definitely decreased because of the challenges. There were strict curfews, the transport was hit, there was also fear to actually contract COVID by mothers. Of course, it wasn't all a bad process. There were a number of challenges.
By the time you'd reach the first home, you'd be exhausted just because you have turned left and it wasn't actually left, or a lot of disorganization. So you finally reach the house. You reach the house, then where to do the scan from. The sofa doesn't work out because, if you're right-handed, you're going to need the patient to be on your right hand. Their sofas probably make you face left or something. Then they're like, we try the bed. Then you're like, go in someone's bedroom, but you're like, cool, since we're women, it's fine. Now you're late for the next scan, and then the person is going to make you go through the same process and would do, 5 women at most a day. And by the end of the day, you'd be exhausted. Then you have to beat curfew. Your last scan landed you in Entebbe, and yet you live in Chanja, then trying to commute back. It was a lot. And there were all kinds of weird stories. Once had rats cross over our feet. Home-based care was interesting. Yeah, but we quickly realized that, this thing is not going to work as well as we envisioned. And with time, you're realizing, oh, wow, the numbers are growing. I can actually own my own machine. So we'll come from hiring out the machine on a community-based level to having those people turn into direct clients for either hire purchase or direct sale, depending on their kind of income. And we can keep growing like that. Because Uganda is vast and the number of health centers that don't have ultrasound are more than you can count. Even if you moved along any street, you could count more than 5 or 10. And the need is actually very high. I think for JICA, the reason why we were so excited, because I was like, wow, these guys are actually here for our best interest. They are not rushing us. They're not making us feel like we gave you money, this must work, because remember I told you we tried home-based care and it did not work. They were willing for us to actually learn. So most people, if they've given you funding for something and then all of a sudden it hasn't worked, they're like, what do you mean? But because they gave us that time and they gave us the patience, we then iterated and then came up with something better, something that could work. So for me, support doesn't mean that you're imposing what you want your vision for MScan to be. It means that you are looking at my vision and going like, hey, I want to help you through this journey and I'm going to be here through thick and thin. That is what support is.
Through working with you, we could learn a lot. We know what is happening in the private sectors, what is happening in startups in these countries. That's very luckily. Last year we could organize Ninja event and 19 African countries participated, as Mr. Ivan mentioned. And MScan from Uganda got a first prize. So I was so proud. So now I can say that private sector development is one of the main pillars, one of the main stories of JICA Uganda's interventions in Uganda.
We are transitioning now to a community-based model for ultrasound. We know that people are in their communities have like clinics which they attend to. So we provide days in which MScan comes and provides like services. If the health center gets people coming, mothers in the intent of flocking this health center, then they're able to understand the impact that MScan can create, and they're able to buy our MScan device. So we're trying to transition to a community-based model that allows us to penetrate and sell our devices to these community health clinics.
Since Kalangal has 84 islands, the work that we've done with the main island can be replicated over and over, man. And commercializing and scaling our impact, both our income and our revenue, I think it's possible. We can hit 2 birds with 1 stone. We've come to learn on how to actually also make revenue out of the social good that we are doing. So, getting feedback from the customers, we get to better the product and also understand what the customer needs, and also understand what the person bringing the money, needs, especially for the clinic owners. What can we do for them to have our devices? What unique value do they report back to us that we are offering them? So if I do that, it would be something like this. So if I increase this, the wall is going to become as though it's bigger, but I'm just increasing the area to get a good measurement. Now when I come to measure,
it needs to do a form of a reset in the software.
I see.
So but, that those the millimeters, the walls of the gallbladder, they go within
crystal, more detailed, fine measurements.
Yeah,
I get your point.
If there is an ultrasound scan, that person can be saved early because they will see it, and they detect and they diagnose, and everything gets back. So it is because of not having access to the scans that those conditions they become big problems and die sometimes. So to me, it gives me pain. And because it gives me pain, that's why on top of everything I was doing, I opted to go and do a study in a ultrasound scan, become a sonographer. From that, after having learned that there was a great need that I was seeing mothers, sending a mother from here to the nearby, that was massacre by then. So when I was seeing that mothers were really suffering in that form, I decided to go and study. I thought if I can do it, I can save lives.
Is a girl, is a boy?
She's a girl.
It's a girl.
Yes, just it.
Okay. I like a girl.
You like a girl?
Yes.
Do you have other children?
Yes, I have one.
Girls or boys?
The girl.
The girl, so you need girls?
Yes.
The child is okay. Yes. Only one problem I can see is there are cords 3 around the neck of the baby. Don't deliver from anywhere.
Yes.
You deliver from the hospital.
Okay.
It's better that you deliver from the hospital because in any case, in the hospital you can be helped.
Okay.
Growing up and having a mother who's a midwife, I appreciated having the opportunity to be in a place or a space where I can impact people's lives directly. And that has shaped my life both as a medical doctor, but has also given me, it has also kept me on the path, as both a co-founder and an employee of MScan Uganda. So for me, I feel like I'm fulfilling my life mission here at MScan, and I'll continue doing so in whatever capacity that I feel that I can produce the biggest impact.
Well, when I look back, it was, we were young students, medical students, going about innovation. And for me, it was about winning. We really wanted to win something in terms of competitions. This was a big competition up by UNFPA. And we did all we could actually to win this. And when we won,
we now got to see the real drill of having an innovation, having an idea, working about it, and seeing that it actually turns out to be something that's very impactful.
What has been your aha moment, away from the winning, that you realize that we are up to some great work? You know, was it like a comment you got? Maybe your parents saw you on TV, they're like, oh, we've seen Innocent. Was it that moment, or was it when girls were in your inbox and they wanted to chat with you all the time?
It's crazy.
What was your aha moment, man?
I think it's actually when the device worked. Like, you know, we were in the field and the device that, you know, we've been developing worked. We're like, wow, this actually can work. The journey has really morphed into just being young people interested about winning to actually people want to change the world and see all the good that is in the world, especially regarding maternal mortality.
I think definitely we need funding. We need funding. Funding is key. It helps us to keep the lights on as a company. So I have to be honest, we have to first keep the lights on. There are very many startups or businesses in Africa that, you know, there's a study that up to 80% of all startups or businesses that start in Africa don't see their first birthday. We need all hands on deck now more than ever. That's all I can say.
Ogwasooka nagenda just kulaba omwana ali bulungi munda nga nali wa myezi 2 naye nga ngenze just kulaba omwana akulidde watuufu tali mu nseke. Then ogwokubiri nali siri weero gugendamu kubanga nali manyi sikyamaanyi nnyo tekyetaagisa nga nze neerindidde lunaku kukola ki kuzaala. Era fine nagenda ku antenatal okunywa eddagala. Dokita omusawo yambuuza sikaani esembayo wagikola? Ne mugamba nedda nnyabo sinnagikola. Naŋŋamba olina ogikola. Naye nina kyembadde mbuusabuusa nti omwana alina endera 2, alina ate yeewanise nnyo, tosobola muzaala. Ezo endera zijja kulemesa okukola ki? Okuzaala. So nankansolinga naŋŋamba naye beera bulungi, beera mugumu, ojja kuba bulungi. Kale kye nalaba nti nali nnemeddeyo naye nga nnina ekizibu ekikola ki? Ekindiko munda nze kyesikola ki? Kyesimanyi. Naye M-scan yalaba ate ebyasingako obungi kuba yalaba endera omwana alemedde waggulu. Singa teyali sikaani tebyandibadde birungi. Singa nalemera mu kyalo nezaalira mu byalo eyo era kirabika tebyandibadde bulungi. So neebaza Mukama. Tuli bulungi, tuli happy, omwana ali bulungi, tetulina buzibu.
Good to see you. Prosper. Yeah, we also look forward to visiting you. Oh my God, this is so cute.
We're really glad to visit you, Phoebe.
The gift of M-scan.
An
M-scan baby.
An M-scan baby.
Joel, so did you use the M-scan device?
To be scanned by a device that she also owns was a very humbling experience to her. To myself, it was as well so humbling because again, it's a journey that you see her take.
Yeah.
And it was a very, you test your own synthesis. And she's in the process, she's scanning herself. And here we are with the baby. It's an experience I think we can't have otherwise if it hadn't been for M-scan, really.
That's great.
Yeah.
Did you see the leg? Did you see the hands?
Because I was so inquisitive, asking too much. Yeah. I think now, and because you asked and you don't know, now this is the confirmatory test. The forehead looked big on the scan. Yes, it's the mother's future.
Come.
Yeah.
Oh, joking.
Hi, Mama.
You are really a power couple. It was the first M-scan marriage, first M-scan baby.
The first of many.
I think you're making 4 years this year. 5 years. 5 years, yes. 5 years.
It's a big year, guys.
It's a very big.
We should have
Throw a party.
This could be the pre-party.
It's nasty. I would have cooked up a storm.
Yeah, but it's been a worthwhile journey. And, seeing team members, succeed in different ways, to me, I think it's quite to celebrate.
And to see us grow. I keep remembering that time, when we were going to do demos and we had that wooden thing. Yes. We've come from far.
I think innovation, sometimes it's fake it until you make it.
Yeah.
You hold onto the idea.
Onto the dream until it comes
true.
Because I remember at that point in time, everything we thought would work out wasn't working. Yeah. Yes.
So it's been a worthwhile journey. I think our lives have transformed. There a lot of things are happening for you. Innocent is next this line, though you can see. So.
You're kidding me.
We are ready to eat the parties. And I have 3 potential weddings and introductions because I must be part of our call. In fact, I must take the flower.
So in the next 5 years, we want to do 1 million scans for mothers who have never accessed or afforded ultrasound scans, but also want to make sure that we scale, we become a self-sustaining entity that is able to bring in revenue that sustains the business, the operations of the business, but also scale across East Africa where the problem of maternal mortality is access to early diagnostic medical services is also a challenge. So we want to get to that space, and I think M-scan should be a household name across Africa in the next 5 years.
And we've been crawling for a very, very long time. And I think now we're walking and the future looks bright. If we take off at the pace we're at right now, we will definitely be doing those 1 million scans in the next 5 years.
I look at us manufacturing these devices in Uganda.
Yes.
Yeah, this is a goal that we are working towards, and that would be really great. Manufacturing everything in Uganda.
Yeah.
Means we need to work more with existing structures like the village health teams, so that they move the word as every time we're into a place. So by working with these people, I think it creates a footprint of where we are, and people get to know about our services, and working a lot with community clinics, especially for the impact that we are doing.
Arriving isn't a certain number of mothers we've scanned, it's seeing that people not having access to ultrasound is a thing of the past. Like, you won't hear of there's this village deep down somewhere and they don't have a scan because they don't have electricity, or the scan is not affordable, or the roads are bad, all those kinds of things that are preventing people in this day and age, especially in low resource settings, from getting access to ultrasound. I mean, that's when we will have arrived.